As AIA, we are the leading employee benefits provider in Malaysia. We always strive to continuously improve our offerings and also work together with clients to better meet their needs, right? And one of the things we want to do is to help them build a happier and healthier workforce. And when we mean healthier, we don't just mean physical health, but we also mean all the different aspects of health: mental health, financial health. And here we are really proud to be able to take this opportunity to launch the first of its kind mental health solutions, which provides end-to-end support to improve our employees' well-being. You know, the pandemic has been difficult for everyone, but I guess one silver lining is that it has made, I think, mental well-being and mental health a topic that is a little bit more up for, I guess, discussion, a little bit more awareness, I think, out there in society, and that's a good thing. So I think there's no better opportunity than now to be able to introduce this solution to employers, and we're very proud to work with you, Joan, and together with ThoughtFull on how we can really bring this solution to life on the ground for our clients.
I think if there is one thing that is true is the fact that in the employee well-being space or employee benefit space, mental health care is still relatively new and nascent in Asia. And so what we do find a lot of times is that employers do find it challenging to implement holistic end-to-end mental health care for their employees. And so sometimes we'll find employers that run a bit more of an ad hoc approach in mental well-being programs. They over-index on things like, maybe education, webinars, workshops, and then under-index on things like continued learning, continued resources for sustained engagement, or even measurement. Are the programs being implemented effective? Are they truly benefiting employees? And so I think when it comes to bringing true holistic well-being to the fore in offices, I think that's something that is still a gap. And really, this is one of the reasons why we wanted to partner with AIA, because you have always been at the forefront of healthcare innovation and coverage. And we couldn't be happier to partner with you to bring to life this mental health solution that will bring greater access to end-to-end mental health care seamlessly for corporates all around Malaysia.
So back to the pandemic, right? I think it's really shone a light on the mental health and the importance of really taking care of mental health as workers all around Malaysia, and actually not just Malaysia, right? All across the world. We are navigating a lot of new things. How do we manage the fear of living with COVID? How do we navigate the challenges of working from home or even working from office, right, in the new normal? How do we manage all this heightened financial stress and all these different things that have really come up because of the pandemic? And we really want to take this opportunity to make mental health something that our workforce can talk about with their employers. We want to create a safe space where it's okay to talk about mental health and it's okay to come forward to express the help that you need. And with that, we've launched this first in the market mental health solution, really that provides end-to-end support, not just on the preventive side, so really helping people to catch some of the the mental wellness challenges, but then also to be able to provide medical coverage for the treatment that they may need, with they face any more serious challenges. So really, I think the pandemic has been very tough for everyone, but with it, I think has also come a lot of good things, I suppose, if you can call it that. And there's no better time to really come in now and really show that we are really serious about helping companies live healthier, longer, better lives. And more than that, we actually have tools together with our partnership to help them navigate that.
I couldn't agree more with you. I think if there's one silver lining around the pandemic and the last 2 years, it's the fact that health and well-being is now a priority, and it's something that we cannot deprioritize because things have fundamentally changed, right? But if there's one thing that I think is always a barrier when it comes to access to healthcare, whether physical or mental, it's actually cost and affordability. And so physical health, as we know traditionally, has been better covered, whether it's by insurers or with governments. But when it comes to mental health though, I think that is where the coverage gap is. Now in Asia, 1/3 of insurers are actually lagging the global counterparts when it comes to mental health coverage. And so there's a lot more that we can do. And I think that's one of the biggest inhibitors for people to access resources. So for us at ThoughtFull, it was a no-brainer to partner with someone like AIA, who has always been at the forefront of innovation in healthcare coverage. And together, we hope that we'll be able to bridge this cost and coverage gap so that more people around Malaysia, through corporates or otherwise, will be able to access mental health care end-to-end in a more affordable and accessible way.
So Joan, earlier you mentioned just now that for many insurers as well, coverage for mental health is lagging. For us as AIA, the leading employee benefits provider in Malaysia, we do actually currently already provide mental health coverage, but now together with this partnership, we have gone one step further to be able to provide an end-to-end support for mental well-being, combining both the preventive aspects as well as provision for mental health coverage. As really part of helping people live healthier, longer, better lives, we really want to be there for them, just not when they are sick, but also before they are sick, before they actually show symptoms of needing treatment. And together with ThoughtFull, we want to be able to educate, build awareness, provide them coaching as well as support to help identify where are some areas of their life that may be needing a little bit more support on to build mental health, to build better mental health, as well as to build up their resilience and to help catch anyone who's perhaps on the trajectory to becoming more and more ill. And we really want to be there for them. We want to support employers as they go on this journey, because really mental well-being is really important, I think, in an organization, because it's really about people and how do we keep our people happy and healthy.
Absolutely. I think going beyond coverage focus on illness, right? I think a lot of times coverage is anchored on that. The one thing I do realize that's very different in this offering and through this partnership is the fact that we're bringing it one step further to include preventive care in a meaningful way. Which is actually one of the biggest differentiators, is the fact that it's not just a value-added service that's opt-in, it is truly coverage that's embedded within the mental health solution for end-to-end care, preventive all the way to treatment. That's one of the biggest differentiators. I think the other thing as well is, at ThoughtFull, as you have seen us work with the employees at AIA Malaysia as well, is the fact that we always strive to be partners to the human resource departments. We don't expect HR professionals to be mental health experts overnight. And so we want to partner with them to make sure that should they want to implement an end-to-end holistic program, all they need to do is hit play and everything will be taken care of, whether or not it is on overcoming the stigma inherent with a topic like mental health, or whether it is creating a psychologically safe space for the employees to engage, to express themselves, or even to have continuous engagement proactively. Are you going through one-on-one bite-sized coaching? Are we really continuing our learning journey? Are we progress tracking? All of those things are things that I think are huge differentiators and definitely a step in the right direction as it comes to mental health.
We are very proud to be taking this first bold step to work with employers to prioritize mental well-being in the workplace. We want to create a culture where it's okay to talk about mental health, and not only that, to back it up with concrete actions and solutions that we can take to employers so that they can really help their workforce. Through this solution that we have built together with ThoughtFull, we want to be able to enable employers to support their employees who really need medical treatment. But on top of that, also to support them to build a happier, more resilient workforce, which is very important in today's highly competitive world. Being able to build their mental fitness will be able to help them to flourish both on the professional side as well as their personal side, and this will definitely contribute positively to any organization.
I think this mental health solution will have long-standing ripple effects beyond just the mental health ecosystem, but the general stakeholders as well. And we're talking beyond insurance. We're talking about, together with corporate employers, we're actually acknowledging for the first time that mental health care is worthy of coverage and that it is okay to actually engage with it, just like how we engage with other parts of our health and well-being. And so I think that will have huge implications as we scale the accessibility of mental health care to as many hands as possible out there in Malaysia. The other thing as well is the fact that we don't just stop at acknowledging, we don't just stop at talking about mental health. The fact that we went so far as to ensure financial coverage is there for whoever wants to proactively engage with mental health is going to set the example and really lead the charge in the industry to show that, hey, if we're going to really advocate for greater mental well-being, then we got to go the whole way, not just end-to-end in terms of services, but also in terms of coverage. And I think that is truly a pioneering act.